Have you ever felt kind of lost in the maze of all these mental health terms? You hear guidance, counseling, psychotherapy, but what's the actual difference? Well, today we're going to make it really simple by following one person's journey to find the right help at exactly the right time.
So we hear these words all the time, right? Guidance, counseling, psychotherapy. But are they all just fancy ways of saying the same thing? Spoiler alert, not at all. Each one offers a really unique kind of support for very different challenges. So let's jump in and figure out what sets them apart and, more importantly, how you know which one someone might actually need.
The best way to get a handle on these concepts is to see how they work in real life. So we're going to follow the story of a university student named Adam. We'll watch as his needs change and see how the type of support he requires has to change right along with him.
All right, so let's meet Adam. He's a final-year university student, a real high achiever. But lately, something's just off. His grades are starting to slip, and he just doesn't seem like himself. We're going to find out why. Adam's journey unfolds in three really clear phases. First, it just starts with some basic confusion. Then, it gets deeper, into emotional distress. And finally, things escalate into a full-blown crisis. This progression is basically our roadmap for understanding these different kinds of support. Let's start at the beginning, in Phase A. At this point, Adam's problem isn't really emotional or psychological. It's much more practical. It's simply about not having the information he needs to figure out his future. So, to be specific, he's feeling totally lost about what he's supposed to do after he graduates. He has no idea what jobs are even out there, let alone how to write a decent resume to apply for one. I mean, it's a pretty common thing a lot of students go through. The real question is, what kind of help does he need right now?
And this brings us to our very first key term, guidance. I want you to notice how specific this is. Guidance isn't about some deep dive into your emotions. It's all about getting concrete information and clear direction for external problems, like, choosing a career. It's practical, it's direct, it's exactly what Adam needs at this stage.
But then, things change for Adam. His situation evolves. The problem isn't just about career planning anymore. It's become much, much deeper and way more personal. Let's move into Phase B and see what happens.
So in this next phase, Adam goes through a really tough breakup, and it hits him hard. He's just overwhelmed with sadness, he can't focus on his schoolwork at all, he finds himself crying a lot, and he starts pulling away from all his friends. These are all classic signs of real emotional distress.
Now this brings us to a really important question. Would simple advice, just giving him guidance like, hey, just get over it, or focus on your work, would that be helpful here? Is guidance still the right tool for this job? I think we all know the answer is probably not. His needs are different now. And this is exactly where counseling comes into the picture. See, unlike the direct advice you get from guidance, counseling is a therapeutic process. The goal isn't just to be told what to do. It's about getting help to explore and manage your internal world, your feelings, your personal issues, so you can improve your overall well-being.
This slide here just nails the difference, right? Guidance is for external problems, like finding a job. Counseling is for the internal struggles, like the pain from a breakup. To put it simply, Adam doesn't need a map anymore. He needs a safe space to work through what he's feeling. He needs counseling.
But Adam's story doesn't stop there. His situation doesn't just stabilize. It actually escalates into what we'd call a crisis. His symptoms go way beyond just sadness and stress into something far more alarming. This right here is the turning point. Adam begins to experience auditory hallucinations. He's hearing voices that aren't really there. And the critical part is, these voices are telling him to harm himself. This is an incredibly serious symptom. And on top of that, he develops these paranoid delusions. He becomes completely convinced with zero evidence that someone is watching him through hidden cameras. So these two symptoms together, the hallucinations and the delusions, point towards something called psychosis, which is a condition where a person can start to lose touch with reality.
So now the question becomes even more urgent. Is a general counselor equipped to handle this? Can you just talk through these kinds of symptoms? I mean, the complexity of this situation really demands a much higher level of specialized care.
And that's where we get to our third level of care, psychotherapy or specialist treatment. Now, this isn't just talk therapy. This is treatment managed by licensed professionals like clinical psychologists or psychiatrists. Their job is to actually diagnose and treat complex mental disorders, and they often use specific therapeutic models and sometimes medication to manage severe symptoms like psychosis.
Okay, so let's pull all of this together and just quickly recap Adam's journey. Because when you look at his progression, you can see the distinct roles of guidance, counseling, and psychotherapy so clearly. This table puts it all together perfectly, doesn't it? In Phase A, his career confusion needed guidance. In Phase B, all that emotional distress called for counseling. And in Phase C, with the really severe symptoms of psychosis, he needed specialist psychotherapy. It's a clear progression. As the problem changes, the solution has to change right along with it.
And that really is the biggest takeaway from Adam's story. Getting help is obviously important, but getting the right kind of help at the right time is the most critical first step you can take towards recovery. If you mismatch the need with the service, it can just lead to frustration and support that doesn't really work. So this all leaves us with one final, pretty important question. Adam's story is a clear guide for us, but how can we, in our own lives, as friends, as family members, as colleagues, how can we get better at seeing these different signs in others and helping them find the right support? How do we build a world where everyone knows the difference?